Everybody. Can I say first up, the New South Wales Government wants to thank all of our citizens, especially those in northern New South Wales, for their patience over the Easter break, as all of New South Wales is now in line in terms of our restrictions. And obviously, as expected, across Easter, testing rates have been a bit lower than previous times, and we just want to encourage everybody during this time, especially as the vaccine is being rolled out, that we cannot be complacent. We need people to come forward and get tested. We need to keep those testing rates high. We need anyone with the mildest of symptoms to come forward and get tested and follow the health advice. But also we need to make sure that we comply with all of the COVID safe plans that businesses have. Can I stress that the New South Wales Government will be really focusing on compliance of businesses in relation to QR codes, social distancing, and making sure they have a COVID safety plan. Our expectation is that businesses will at all times have at least one member of staff who's making sure that everybody is complying with the COVID safety plan, whether it's staff at the venue or whether it's all the patrons. And we don't want to see QR codes hidden at the back of a venue. They need to be front and centre as people walk into that venue to make sure everybody complies, because if there is anybody with the virus in any location, we want to make sure we get on top of it. So can I please stress that compliance will be increased in New South Wales across all venues, across all sectors, to make sure that businesses and patrons are complying with COVID safety plans. We simply cannot let our guard down at this stage, critical stage of dealing with COVID. And as we saw just before Easter, ironically, it wasn't the hotel quarantine system where we had that outbreak, but certainly someone coming in from another state where they hadn't been vaccinated. So it's really important for us to be on our guard and to make sure we stick to all the COVID safety plans. Can I also stress that the New South Wales Government is working hard to distribute all of the vaccines that are supplied to us. And in that vein, I just want to make a few points. Firstly, the New South Wales Government is already in the process of establishing 100 sites across the state to provide that access to the vaccine. So 100 sites, around 80 of them are already up and running. And this is to make sure that everybody in rural and regional New South Wales, as well as other locations outside of Sydney, can get access to the vaccine to complement the GP network. So as we know, the federal government has the responsibility for making sure everybody is vaccinated. The GP network was to be the main source of that, is to be the main source of that. And the New South Wales Government has responsibility for administering 300,000 doses. We've done about 130,000 doses already, and I envisage we'll pass the halfway mark in terms of number of doses by the end of this week. But in addition to those 100 sites, and I want to make it very clear that in addition to those 100 sites, the New South Wales Government will also be setting up a vaccination hub at Homebush. And this is to allow us to support the Commonwealth in distributing the vaccine once we have finished the 300,000 that we said we would do. But I also want to make this point. The hub at Homebush will be in addition to the 100 sites we will already have up and running. So the New South Wales Government, even after we've done the 300,000 we were asked to do, will continue to have 100 sites up and running across the state, in addition to a mass vaccination hub at Homebush. We anticipate that post the 300,000 that we're responsible for, we'll be able to do around 60,000 vaccinations a week. Half of those will be done at Homebush, and the other half will be done across the other 100 sites across the state. That number could go up depending on demand, but we think that we're capable of doing around 60,000 doses a week as a state post the 300,000 that we've been asked to do. And this is to support the GP network and to support the Commonwealth, because given where we are at the vaccine rollout, New South Wales doesn't want to see further delays, and that's why we're stepping up to support the Commonwealth. But can I also make this really critical point? Our ability to do 60,000 vaccinations a week depends on us getting the supply of the vaccine from the Commonwealth. At the end of the day, the Commonwealth is responsible for getting the vaccine to the states. They're responsible for making sure we have those doses to be able to give out. And as you also know, the New South Wales Government is incredibly proud of our record. We actually are providing now daily updates on the doses, on the vaccine rollout, so everybody can access that information on a daily basis in a timely way. I just want to make that very clear. But our ability to complete the 300,000 that we had responsibility for, in addition to doing the 60,000 extra a week, is dependent upon the Commonwealth getting us those doses. That's their responsibility. We want to work with them and support them as one team to make sure that we live in a COVID-safe environment, in a COVID-safe world, and we will continue to work with them to make that possible. I'll now ask Dr Chant to give her health update. Minister Hazzard will make some comments, and then we'll be free to take any questions. Thank you.
So New South Wales recorded no locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and there were 6 new cases acquired in overseas quarantine. There were 4,876 tests performed, and as the Premier indicated, our testing numbers have seen a drop over Easter. We do urge every member of the community, with even the most mildest of COVID symptoms, please come forward for testing. Maintaining that high level of testing in the community does give us that added assurance, and obviously we complement it with other passive surveillance systems such as our sewage surveillance. I'd also like to thank the individuals in the Northern Rivers, North Coast, who have adhered to our requirements around isolation over this Easter weekend. I know those people that we've notified to be in isolation for that full 14 days need to stay in isolation for that full 14 days and undergo that testing that we're recommending at various intervals, because we are dealing with a variant of concern. Can I thank you for staying in over such a beautiful Easter long weekend, and it is through your commitment that we haven't seen any further cases arise in the community. I would also like to re-emphasise again the importance of the QR code check-in. The QR code check-in was critical in our control of the North Coast outbreak. The fact that we could contact individuals rapidly within a few minutes of notified of a case has really assisted our response and the comprehensiveness of it. So every time that you might say, oh, there's no cases of COVID in the community, do I really need to check in? My answer to you is yes. You never know when a case is going to pop up in a venue, and therefore that QR code system really provides that reassurance to us that we can contact you and provide the most appropriate public health advice at that point in time. So please continue to check in.
Just further on the issue of the QR codes, as we saw in the last couple of weeks, New South Wales is not an island. We are very much part of the larger continent where obviously not all states and territories have got, and all residents from those states and territories have the same understanding and importance of the QR code. Dr Chant has told us many times, and we do understand, I think, in New South Wales the importance of QR codes. But in some other states and territories they haven't had as much experience as we've had in that regard. And so when we have visitors coming into our state, one, we may be vulnerable to any weaknesses that come from other states or territories in terms of perhaps, as we experienced in Queensland, some issues there, and that's not to reflect on Queensland, it's just simply to say that we are not an island here in New South Wales. We need to recognise that we are vulnerable to others coming across the borders. And so my message very strongly to the community is back in Dr Chant and the health team by making sure you do your QR code when you go into a coffee shop or a restaurant or any of the other places where you're expected to do it. Can I say to the businesses across New South Wales, thank you first of all for being so supportive with the QR codes. The majority of businesses are still doing what they've done through the darkest days of COVID. And making sure the QR codes are there at the front door for people to actually to do the QR code when they come in. But there are some, and I've seen this personally, there are some businesses who are, putting it bluntly, getting pretty slack about it. And that's something that just can't continue. The reality is we're still living in a 1 in 100 year pandemic. There is still the risk that COVID could break out. And as time goes on, that will be something which will be very important for us all to keep those QR codes going. At some point, our international borders will open up, at some point, well down the track. And at that point, if we're not still in the habit of using those QR codes and understanding the absolute significance of being able to track and trace and head off any outbreaks, then we could, in fact, face some further issues. I want to also just thank the hospital staff across. We've heard that We've got about 100 of our public health public health hospitals and outreach areas operational. By the end of this week, there'll be about 100. I was in Tamworth yesterday and saw the local health staff being vaccinated. It is incredible that our public health staff right across New South Wales are coming forward in great numbers to be vaccinated, but also the actual staff who are providing it. Thank you to those staff for setting up very efficient operations right across New South Wales. I can assure the community that whatever we can do to support the Commonwealth after we've managed to get all of our obligations done, that is quarantine staff, which are largely done, or 100% done at this point, except for those people who are coming on board to work in the quarantine areas. They still obviously have to be done as they come on board. But also our frontline health staff, our ICUs and our EDs are largely done, and now we're reaching out to nearly 150,000 of our public health staff across New South Wales. At the end of that, as the Premier has said, we're quite prepared to kick in and help with our Commonwealth colleagues to roll out the vaccines that they thought they were going to be doing. But of course, the message is still GPs are first and foremost who people should be reaching out to. If you have a GP, then certainly go to the GP as soon as your GP's got the supplies of vaccine. But of course, all that we do here in New South Wales is entirely dependent on the vaccine supplies that the Commonwealth Government is trying to make available. So we're all in the hands to some degree of the Commonwealth Government and the suppliers of the vaccine. And the community do have to understand that we need to be keeping our ears to the ground and just listening about the availability of that vaccine as it proceeds. Thank you. Yeah.
Last week the Feds spent the whole week backgrounding against you guys and how slow to roll out the basically funding the states. Today Scott Morrison's got up and said, it's actually the fault of the EU. Is this just more excuses and should the federal government just get on with it?
I'm not going to comment other than to say that it's a challenge in a pandemic to get vaccines. Every country in the world is fighting over trying to get vaccines. We're very lucky. A year ago this time, when I was standing in front of you, I was saying regularly that I doubted whether we'd ever get a vaccine. There never has been until this incredible outcome in the last few months. There never has been a coronavirus vaccine. So I think the federal government's done a very good job trying to ensure in times when there was no clarity that we would have vaccine, that they have some opportunities for us to access vaccine. But of course, that arrangement is entirely a matter for the federal government, and each state and territory is in the hands of the federal government as to the availability of those vaccines, and I'm not going to comment beyond that.
Why is it in the hands of the federal government? Why can't we just go it alone and buy our own vaccines, source them ourselves, sort this problem out, get rid of the federal government and do all of their excuses?
I love your enthusiasm. Look, the reality is we are a federation, and the federal government are doing what the federal government should do, which is to negotiate with major providers for vaccines around the world and supply it to the states and territories. I can think of nothing worse, to be honest, than all the states and territories competing against each other to access the vaccines. We're one continent, we're all Australians.
Seeing as we haven't had a COVID case in a week, was it an overreaction to cancel the Blues Fest?
The decisions that were taken and are taken all the time are based on our best public health advice. I don't think anybody in Australia could say that we don't have, well, I think we have the best Chief Health Officer in the country and the best public health team, and we take advice on that basis. If we had not made that decision, we may be standing here today trying to explain why we had hundreds, if not thousands, of people who actually did have COVID. So it's always good to be able to say that we got a very positive outcome from the decision that was taken.
Is there an update with the organisers about when it might be able to be held?
Look, there's a lot of work going on behind the scenes with Peter Noble and with Blues Fest. I'm really keen to see the Blues Fest come back on, and I think there's a lot of us in the community who are keen to see it come back on. But that has to be worked through by Peter, and it's a big challenge. It was a very big festival that he was going to be having, and I'm sure it'll be on again sometime, hopefully this year.
Just on the new vaccination hub that will be set up at Homebush, just to clarify, when exactly do you think it'll be set up? And just to be clear, is it to supplement the GP network?
As I just said, actually, that First and foremost, the federal government are rolling out to their area of responsibility through GPs and through Aboriginal health services as well in New South Wales. And GPs are certainly the front line and will remain the front line. What the New South Wales government is saying is we are here to help you and achieve the targets that you thought that the Commonwealth could do, but for various reasons haven't yet been achieved. We are there to support you. We'll have this mass vaccination centre available. Leases are being signed in the very near future, and then there'll be a lot of work doing. It's not just a case of walk in and start vaccinating. There's a lot of infrastructure that has to be provided, and that should be up and running within the next couple of months or so, depending on vaccine availability. We'll give more information on that. But
it is to do like the general population.
Yes.
So,
yes, yeah, absolutely.
Minister, in the past 24 hours, the Prime Minister and Brendan Murphy have both essentially said that mass vaccination clinics in Australia haven't been set up because we don't have the supply. Why has New South Wales decided to forge ahead with this?
I'm sorry, can you say that again? What's been said?
So in the past
I've heard a lot of
24
things being said,
no,
but
that's okay. The Prime Minister and Brendan Murphy have both commented to say that the reason why we haven't had mass vaccination clinics in Australia is because we do not have the supply. New South Wales is now saying at some point in the future we're going to have 60,000 doses a week coming out of this clinic. Why is New South Wales forging ahead with this mass vaccination plan?
I haven't heard those comments from Brendan Murphy or the Prime Minister, but I think everything New South Wales has done to date has been based on the information the federal government has provided as to the availability of vaccine. There's been no indication at this point to me as Health Minister that they're not going to have the vaccine available. So we're working on the basis that they will have the vaccine available, and we have to be ready for that eventuality. And of course, there's no question that it's been publicly acknowledged that the federal government had set certain targets which have not been achieved, and that's not casting blame anywhere. It's just a reality. It's a fact. So New South Wales is doing what we should be doing to step in and help our citizens get vaccinated as soon as the federal government can make the vaccine available.
But it's obviously just with GPs, there has been problems like a lot of GPs are saying they're not getting doses that they've been promised. So does it mean that then the states are going to compete with the GPs and take?
No. First and foremost, as we've said, I think the Premier has said it and Dr. Chant has said it, we will be setting up a mass vaccination site which is very accessible, but our expectation is that the vaccine will go to the GPs in the first instance, and we're expecting additional vaccine to come to us to assist in what the federal government have said they want to do. This is about the New South Wales government backing in the federal government, but at the end of the day, the federal government has to be able to provide the vaccine, or nothing can really occur in terms of a mass vaccination site. And we're already hearing, obviously I've had calls from GPs saying that they might have only been given 50 doses, and yet they could be a practice of 10, and they could be doing hundreds each week. So, there's some big challenges that the federal government have to overcome, but New South Wales government's there to back them in and to work with them, to support them.
And with the confirmation of Homebush, does that mean the ICT idea is null now, not going to go ahead with Darling Harbour?
The only announcement we're making is at this stage is that there's a mass vaccination centre that will be at Homebush, and we're not ruling anything in or out as we go down over the next 12 months, but the focus is on Homebush.
And the 100 sites, they're the hospital hubs you were talking about earlier in the year?
Yeah.
Okay.
And
is that addition to the 36 clinics that were...
I can hear my Premier wanting to say things here. Always know my place. I'll step back and let the Premier do it. Or I can ask, why don't we ask Susan Pearce, who's actually been the person who's been rolling them out, and she can tell you...
Homebush.
I would have come back. You don't have to...
Which venues at Homebush? It's obviously the NRL's going to be on, so it can't be aimed at the stadium.
Is it a testing?
Sorry?
Is it the site?
No, it's a brand new facility, and I think...
It's a commercial building.
It's a commercial building that I'll let Susan make the announcement. Can we make? Yeah, you do.
Thank you, Minister Hazzard. It's a commercial building which Health has secured, and the contract for the lease is being signed, and obviously once it's available we'll let the public know. But can I just clarify a point that was made earlier? This is in addition to the 100 sites we have across across New South Wales, and it will be a total of 60,000 doses a week that we think we can get out through New South Wales Health. Half of that will be from Homebush, so 30,000 a week we think we can get out of Homebush, and 30,000 across those other 100 sites to make sure it's accessible to people who live in more remote communities and also in the regions. But again, can I stress this point? This is all dependent on us having access to the vaccine from the Commonwealth. The Commonwealth is responsible for issuing the doses to the states, and all we're doing is saying we're ready to step up when the supply is available. We appreciate the challenges which the Commonwealth is now talking about publicly, and I acknowledge what Dr Murphy said last night, which I listened very intently to, about where things are at. But I do want to stress that our capacity to get the doses out is reliant upon us getting the doses from the Commonwealth, and that's why we'll also be providing a daily update on exactly how many jabs we give every day, how many done over the week, so the public is completely availed of what things are at, where things are at.
So just to clarify, once you've done in 100 hubs, all the frontline health workers, you plan to keep all of those 100 hubs?
That's the intention. That's the intention. So just to be clear, we have set up the 100 hubs to make sure we deliver what the Commonwealth had asked us to do, which was 300,000 jabs. But as you know, our adult population is around 6 million, so we were asked to do 300,000 out of 6 million. But given where things are at, we have decided as a state to say it's in our nation's interest, our state's interest, to try and support the Commonwealth in getting out the jabs. So long as they supply us with the doses, we're able to do, post the 300,000, about 60,000 a week to complement what the GPs are doing, and I understand the pharmacies might be doing. So this is New South Wales stepping up to say we don't know when we'll be able to get those extra doses, but when we do, we'll be ready and available to support the community. Those people who may not want to or can't access their GP can go to have that option. But obviously, if you have an underlying condition and you have a regular contact with your GP, that should be your first port of call. But what we're doing in New South Wales is making sure we don't leave any stone unturned. I mean, all of our citizens can feel very proud of the role we have collectively played in getting us to this point. And we don't want to unnecessarily fall behind the rest of the world. If the doses are available, let's get them out. And that's why we're just saying to the Commonwealth that once you make those doses available to us, we're ready to administer them in a safe way.
Yeah, just on that concern, Matt Keane is often being a copper about his appointment, saying he didn't realise it was going to go so badly. I mean, do you feel like you erred by throwing the weight behind the appointment? And just on second points, some of your colleagues say the appointment shows a disconnect between Cabinet and your voting base. I mean, do you agree with that assessment?
Oh, look, I made extensive comments yesterday. I really don't have anything to add on top of those.
The by-election, the upper Hunter by-election, the Nationals are pre-selecting a candidate tonight. You've almost written off that they possibly can't win. How crucial do you think it is still pre-selecting a good candidate?
Oh, look, can I say we'll put on an extremely strong fight in that seat, and I guess the comments I was making last week were simply to highlight the fact that we would be bucking a major trend not to have the government have a swing against us. I mean, that's just, if you look at the history of by-elections in the last 2 decades, I don't think there's been a single one where there's been a swing to the government or where the swing has been kind of kept at bay. So I was just simply making that point that the maths are against us. But what we'll be doing and what we'll be saying to the people of the Upper Hunter is let us please continue to be a strong and stable government, and we need you to return a Nationals member in order for me and my government to continue to doing the good work for New South Wales.
Premier, there are findings from a coronial inquest that are being handed down today into the murders of Jack and Jennifer Edwards by their father. Now, police have already admitted there were some failings, so John, their father, was able to get a firearm. Are you able to commit now to implementing any of these recommendations that Parliament puts forward?
I'm sorry, I've not seen what the recommendations are, but of course our government always takes recommendations of coronial findings very seriously, and I look forward to getting across the detail.
Premier, you mentioned the QR codes compliance. It's a big issue. A lot of places I go just don't seem to push it at all anymore. You say there's going to be a crackdown. Can you give us details, more officers, and remind us of the fines again?
No, certainly. Well, it's obviously $1,000 per individual who doesn't comply, $5,000 per business. But if your business is a repeat offender, you actually have to shut down your business for a certain period of time. And if we need to make those, we don't want to, but if we need to make those penalties harsher, we will. And I guess as Dr. China and Minister Hazzard have said, unfortunately, when our case numbers are 0 to very low, people do get complacent. All of us get complacent. So what we're doing today is providing a stark reminder to the community. This is not the time for us to undo all the great work we've done. And we're increasing our compliance by up to 30% in some parts of the state. And most people are doing the right thing, but you have to make sure you have the intent to do the right thing as well. So you might be having a QR code displayed, but you can't have it in the back corner of the premises. You have to make it easily accessible for people as they come through the door. Please make sure that you at least have one trained staff member at every sitting or every time your venue is open to make sure that patrons are complying and that everybody else in the premise is complying. So it is a bit of a compliance crackdown to make sure that everybody's doing the right thing. It's for our own safety. We've done so well, and we know that the QR code has been the secret weapon New South Wales has had, which other states haven't had. So our ability to vaccinate our quarantine workers so quickly, plus being able to have that QR code, has really supported health in their efforts to get on top of the contact tracing. We know it works, we know it's convenient, we know patrons don't mind doing it, and businesses have been fantastic in adopting it, and so we just ask everybody to make sure that you just keep doing what you've been doing and not be too relaxed or complacent, because this is not the time to undo all the great work we've done.
Is this mass vaccination hub, is this based on what they're doing in America?
Well, no, this is to complement. This is obviously the location we chose was in a large and growing part of our city, so of Sydney. But the point is that the 100 hubs that we've already establishing, 80 of which we've already got up and running, are really designed to make sure that no matter where you are in New South Wales, and we know that some communities are further than others from these hubs, but no matter where you are in New South Wales, you'll be able to get to a vaccination hub in a reasonable period of time, because some communities we know don't have the GP networks or don't have a lot of access to GPs, and this is an alternative for them if they can't access their GP during that time. But again, all of this depends on us having access to the doses, and that's why we're making sure that the public has information every day on how many doses New South Wales has provided to our citizens, but also what is available to our citizens so long as we get that supply, and that's entirely dependent on what the Commonwealth provides us. And I was listening very carefully to what Dr. Murphy was saying last night. That's the latest bit of information I have and the latest bit that Minister Hazzard has. But we were listening intently to what Dr. Murphy was saying last night, and I got a sense that the supply chains are perhaps not what they may have been or what the states may have been told. We get to have that confirmed to us. But really, our capacity to support our citizens is dependent upon how many doses we get from the Commonwealth.
Can I just clarify timing-wise with Homebush? So what you're saying, you can't at the moment tell the people of New South Wales when it will be up and running?
Well, look, we can physically have it up and running by May, but it depends. Again, it's the doses. So we still have to complete the first 300,000, which we've got through the 100. We're about halfway through that job. So once we complete that, it depends on the doses. If the Commonwealth says to us, here are the doses, well, then we can get it up and running sooner. But there's no point getting it, as someone alluded to earlier, there's no point getting it up and running and staffing it if we don't have the doses. So as soon as we get confirmation of the doses, post the 300,000 we need to do, then we'll be able to obviously advertise it and get it up and running. But at the moment, we're staffing all of our hubs because we do bookings online, so we know how many people want to come in and get the jab every day. So we're making sure those 100 hubs that we have are staffed well, and the system is. I've had great feedback from the experience people have had, and unlike other states, our health workers have been extremely enthusiastic and supportive of the program, and we're deeply grateful for that. But our ability to promote that hub will depend on confirmation from the Commonwealth that we have the doses. There's no point getting it up and operational with people staying idle because we don't have the doses yet. So we're in those conversations. Minister Hazzard and the health officials behind me, Susan and the Secretary of Health, are obviously in consultation with the Federal Health Secretary and also the Federal Minister and other state ministers. So as soon as they have any concrete information, we obviously will share that, but we're also limited in the information we're receiving.
You made that generous offer to the federal government to try and assist here with the Max Vax clinics and the other 100 hubs. Have you thought about offering to assist with the rollout in aged care, given that's so dragging so bad?
Yeah, well, the Commonwealth is under contract, so they've already paid out those contractors. So it's really difficult for us to interfere in that or intervene in that process. And frankly, that's part of the rollout that they did. I'm just grateful in hindsight that New South Wales pushed the case to be able to vaccinate our quarantine workers, because that's proven to be a really positive thing to have done, because I just feel that bit safe knowing that our quarantine workers are safer. I mean, a lot of them are about to get their second shot or getting their second shots, but certainly 100% of our quarantine workers have had at least the first shot. Many have had their second shot. So the fact that they and their families and critical health workers who are on the front line taking swabs every day are protected gives me that level of assurance. But obviously, the more percentage of the population that gets the vaccine, the safer we all are. But then again, that is dependent on the doses.
Thank you.
Thanks, everybody.
Just on Tommy Rodolfo's Premier, he's passed away. Is there anything you have to say for the NRL community?
I think for the NRL community and the broader sporting community and for all of us, it's a huge loss. He was a sporting legend, very patriotic about the great state of New South Wales, and will be sorely missed. And I think he'll be, much of his career really demonstrated and epitomised why rugby league is so popular in New South Wales. And I wish to extend my condolences to him and to his family and loved ones. Thank you.